so big and mean, but this playground was made for all of us, and we're gonna change this scene. Well, all of us were scared of the bullies. They were so big and we were so small, till somebody said if we organized, we could be 10 feet tall. We stood on each other's shoulders, put blankets over our heads. We looked like monsters and we roared like lions, and those bullies ran home and hid under their beds. This playground was run by bullies.
How y'all feeling today? Me too.
I'm mad, and I know the docs are mad, and I know millions and millions and millions of people in this nation are mad because we didn't even get to have a conversation about single payer in this country. They just arrived and said, oh no, single payer's off the table. But I don't remember anyone here authorizing them to take it off the table. So my question is, under what authority did they remove it? And so that is the impetus for this tour. That is the impetus for these doctors coming together, which is to say, wait a minute, under whose authority did you take the issue of single payer off the table? Not the people, because I get emails, thousands of them, all the time, every day, from what I'm calling the single payer nation. It's a nation of us out there that know that this is right, and that this is the right thing to do. And this is as much about justice as it is about health care. It's as much about democracy as it is about health care. And it's as much about reclaiming our political process as it is about health care. But there's one more thing I want to say, and that I think is really crucial given the climate that we're in. You know, we're angry, we're mad. But we make a very clear distinction between anger and rage. And anger is a very normal, human, can be a very productive feeling when channeled properly. It can be constructive. To us, rage is always destructive. Its object is always to shut down. Its object is always to eliminate and to destroy. And that's not what we're doing here. That is not what we think democracy is about. We think democracy is about making sure that everybody gets heard, not shutting other people down. So as we go out on the road, and as you think of us out on the road, remember that we will meet what we take with us. So we're not going out with rage, we're going out with understanding. We want to include the people that are angry in this conversation. That's part of what we're doing here. This is a community building event. Even the people who are raging out there are members of our community. So the best thing we can do is not resist them, but try to create a space for them to voice their opinion. We go out with forgiveness, we go out with love, we go out with understanding, and when we go out that way, that is what we will find. That's how the shift takes place. All right, enough of me. Can I have all my mad as hell doctors lined up here, please? So what we're gonna do now is we're gonna try and keep it short. Got a bit of an agenda here, but what we're gonna, keeping doctors under a minute is no small feat, I'll tell you that. But I think what I'd like to do is have you get to know each of them. They're gonna come up, and in a minute or so, they're going to tell you who they are, why we're doing here, and what our goal is.
So I'm Paul Hochfelden. I'm an emergency doctor, and I'm beginning to think for the first time in about 6 weeks I'm kind of speechless. This is just really amazing that you're all here, and we're just, this big wave's getting bigger, and our surfboard's not getting any bigger, and we're just hanging on. But the other day I was talking to one of the television people, and I was going through why single payer is so much the only solution compared to what's being offered. And at the end I said, well, duh. And that really summarized it. And this is about health care, but it's not about health care. This is about our broken political process, and this is about the industry manipulating public policy for profits. And I think what's different about that, and they're doing it again, right? This isn't the first time they've done it. They do it in transportation and in energy and in banking and in banking and in banking. But healthcare affects every one of us. So if we don't get a real solution to our healthcare disaster out of this Congress, we're going to have to take that disappointment and make lemonade. And lemonade in healthcare means we need to fix our political process so that the industry can't manipulate our legislators. And that's what this is all about. Thank you for helping us.
Hello, I'm Samuel Metz. I'm an anesthesiologist. I'm mad as hell because the United States is the only industrialized nation in which poor people die because they cannot afford medical care. This is the only country in which even those of us with insurance can see our families go bankrupt if we have the wrong disease. Our money is going to insurance companies. Single payer is simply bookkeeping. It's getting money from my patient to me without an insurance company taking a 30% cut. Insurance companies out, all patients in. Until the United States doesn't force families to choose between buying health care and buying food, we cannot call ourselves a civilized country. Thank you very much.
Hi, everybody. Thanks for coming this morning. I'm Joe Eusterman. I'm an internist. The last 30 years, I've been specializing in occupational and environmental medicine, primarily dealing with injured workers, workers who are made ill on the job or hurt on the job, and have been heavily involved in workers' comp issues. I've been acutely aware of the last 30 years of what happens to workers when they get hurt or when they're made ill on the job. They lose their job and the fears start mounting. I'm mad as hell about the fear in this country. I'm mad as hell. I'm mad as hell about the fear mongering in this country. I'm mad as hell about the lies that are being told in this country. And it's just simply got to stop. Last night I had another one of those aha moments when I said, you know, we've got fanatics and we've got fearmongers. Let's combine and call them fearnatics. They're fearnatics, you know? Okay, anyway, that's my little witticism for the day. But fear is a big problem. There's much too much fear in this country. We've got to get rid of fear. We've got to get rid of loss of access to health care. So let's get the job done. Thank you very much.
Hi, I'm Rick Stagenborg. I'm a psychiatrist from Coos Bay, and I've been working with these guys for quite some time now. I've never been accused of being too quiet. Anyway, I just... Right up? Is that still too quiet? Can you hear me up there? Okay, anyway, these guys are friends of mine, even the ones I just met. I've been working with them online, and I've been working with them in person since April. We are going to get single payer this time because we're going to do what Paul said. We're going to highlight the corruption of the political process. That's why I'm wearing my Max Baucus Put Single Payer in Jail t-shirt. I'm going to be distributing this in Helena when mad as hell doctors go there. And then I'm going to turn around and I'm going to continue to travel through all the West until we get single payer. And because I'm so serious about taking on the corruption in Congress, I'm seriously investigating running against Ron Wyden. I hope I can count on your vote.
I've practiced medicine in Oregon for 25 years. I don't know anything about politics, but I know a little bit, or try to, about patient care. And I'm mad as hell because we have the best nurses in the world. We have the best doctors in the world. We have the best hospitals in the world. But we're getting third world results. Third-rate health care because of an insurance system that prevents those nurses, prevents those doctors, and prevents those hospitals from giving the care they can. When you compare us to other nations, we have the lowest life expectancy. We have the highest infant mortality. We have the highest maternal mortality of any industrialized nation on the planet. And I want to know from Senator Baucus and Senator Grassley and their cohorts, why don't they want us to be first in the world? I'm mad as hell because a woman who's pregnant in the United States today could choose 24 countries in the world where she would have a higher likelihood of surviving, and her infant would have a higher likelihood of surviving. And it's not our technology, it's not the hospitals, doctors, nurses, etc. It's an insurance system that prevents us from taking care of people instead of helping us do so. I'm mad as hell because after 25 years, I'm positive single-payer, publicly funded, privately delivered health care is the only way to get us there. Thank you very much.
I'm Mike Huntington, a radiation oncologist, and I'm mad as hell because I've seen people suffer unnecessarily because we do not have a system. Between 1996 and 2006, I saw the cost of treating certain types of cancer triple, and the reason is that we don't have a system that decides, is this really important technology that we're developing, or is it just a way to bring income into the hospital? During that time of that tripling in cost of certain treatments, the insurance premiums doubled. So patients that were barely hanging on to their insurance in 1996 could no longer afford it in 1998. Wow. They developed their cough, their pain, they couldn't see a doctor, symptoms progress, and then they come to the emergency room with uncontrollable bleeding or pain, and the diagnosis of cancer is made. Then, of course, after all that suffering, we jump in and try to rescue with $100,000 of tests and treatments to no avail. This is not a system. This is a torture system, actually, that we have. So we need to make some very definite, tough decisions. We as a society need to figure out how to prioritize how to spend public money. 60% of what is spent on health care comes from your taxes, our taxes. We should be in control of that. We need single payer now.
Good morning. Thank you very, very much for being here this morning. We're embarking on a journey that I hope will actually bring about the single payer reform that we're all talking about this morning. I'm Eugene Uphoff. I'm a family physician. I have practiced family practice for 40 years. And I want to tell you that this system that we have is abusive to my patients. We need to change it. How many of you here have ever had any surgical procedure of any kind? A lot of hands. So you may know that we're required as physicians to go through what we call a PAR conference before we do any procedure. PAR stands for Procedure, Alternatives, and Risks. And I think we need to apply that to the healthcare system. What is the procedure? The procedure is to take all of the money that we currently spend in all of the healthcare systems of the world, of the United States rather, and put it into a single source that can be used to pay for the health care needs of everybody. That's the procedure. You may be aware that between 1998 and 2008, the average income, the wage for Americans went up 29%. In that same 10-year period, the cost of living, the inflation, went up 44%. and the cost of healthcare premiums went up 120%. So what are the alternatives? The alternatives are to do nothing. About 3 weeks ago, there was an article in the paper that said that in the next year, the top 60 health insurance companies are predicting an average of a 10.4% increase in their healthcare insurance premiums. We can't afford that. The alternatives are that we will continue to spend more and more money, wasting approximately $600 billion a year on a system that puts money into the hands of CEOs of health plans, to the Wall Street investors, and the pharmaceutical industry. What are the risks? The risks of not doing something, or of just changing the system in a minor way, are that people will continue to die. 10 years ago, the Institute of Medicine predicted that approximately 18,000 people in the United States die every year because they have diseases that could have prevented their death had they had insurance and been treated. They reviewed this last year and felt that approximately 22,000 people died last year because of being uninsured. That is no longer sustainable. That is approximately equal to the deaths that occurred on 9/11 every 2 months. We cannot do this any longer. The time to change it is now, and we need to do it with single payer. Thank you very much.
Hello, my name is Robert Seward, semi-retired internist. I live in Forest Grove. I'm mad as hell because I'm mad as hell. I'm really mad as hell because people are going bankrupt paying their bills. This is the only country in an industrialized world where people are going bankrupt because of medical bills. That is an outrage. That does not occur in Europe, Japan, Taiwan, Scandinavia, Canada. All those countries provide universal care to all their constituents at about half the cost that we do here. They've proven that it can be done. And then I'm mad as hell because Americans are not getting basic health care. Now, what do I mean by that? Well, doctors do two things. They get you out of trouble, and then they keep you out of trouble. Now, the getting you out of trouble is the emergency room in the hospital. The keeping you out of trouble is the clinic and the follow-up. Let me give you an example. 90% of the people here are going to get their care through the clinic. Our new justice, Sonia Sotomayor, she was diagnosed with diabetes at age 6 or 9, something like juvenile diabetes, the kind that requires insulin injections. She's now 54, and the newspaper said that she has none of the major complications of diabetes, which is eye disease, blindness, renal disease requiring dialysis, or nerve damage. How did she get from age 9 to age 54 without complications? She went to the clinic week after week. It was hard work. She checked her blood sugar. She saw a physician. She saw her provider, nurse practitioner, PA, the dietitian, the pharmacist. She worked and worked and worked to control her blood pressure, her blood sugar, and it's paid off. So now she's 54 and she's good health. She's a vigorous person. That's basic health care. It's not sexy. It's not a transplant. It's not bypass. It's simple stuff. Just taking her insulin, just checking her blood pressure and monitoring her. Now, you think about the 46 million people out here that have no insurance. They're out there. Their blood sugars and blood pressures and cholesterols are out of control. That's shameful that we don't do the basic simple stuff for our Americans. So that's just one. That's the second reason I'm mad as hell. But I gotta wrap this up. But that's basically it.
The mad as hell doctors, thank you guys very, very much.
Well, we got that playground back, but then we looked walked across the street, saw the sewage plant belching out smoke, poisoning the ground under our feet. It's giving us all asthma, and the hour is getting late. So we marched across the way, and we blocked that factory gate, 'cause this world is run by bullies, and they're all so big and mean. But this world was made for all of us, and we're gonna change this scene. This world is run by bullies, and they're all so big and mean. But this world was made for all of us, and we're gonna change this scene.